Cian Byrne is a 10-month-old baby boy who was diagnosed with a rare chromosome disorder, Cri du Chat, just 4 weeks after his birth.
Last October, medics told Cian's mother that there was nothing more they could do for him and he was put into palliative care. Cian is now proving them all wrong and is fighting every day to stay alive. His mum, Joanne Kennedy Byrne, joins us now along with Paediatric Liaison nurse Dr. Caroline Thomas. But first, let's take a look at Cian mouthing his first words.
Ba 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 ba.
Oh, amazing.
You were whispering something.
I'm a nurse, not a doctor. My title came across as I'm a nurse, not a doctor. One of the doctors.
You wanted to clarify that.
Just to clarify that.
Thank you.
Okay, well look, actually, can we do the science bit first?
Yes.
Okay, absolutely.
What is Cri du Chat?
Cri du Chat is a chromosomal abnormality where part of the genetic material is missing on chromosome 5. It's a very rare disorder, only occurs in about 1 in 50,000 births. It was discovered in France about 50 years ago. So again, it's not very widely known about.
How does it manifest itself? What are the symptoms of it, or how would you recognise it?
Cri du Chat can be diagnosed usually at birth, usually on symptoms. The child can have varying levels of...
Nasal bridge.
Yes, developmental delay is one of the biggest things. So failure to thrive, failure to gain weight. So sometimes they end up with a feeding tube. So whereas a normal child would be oral fed with a bottle, so they can have trouble gaining weight.
I know in each case it's different and it manifests itself in different ways, which makes it very difficult to diagnose and even more difficult to treat. But is the inability to swallow, is that a common thread in all of it? Is that
most children?
Most of the cases.
So that means that that can't swallow, so can't aspirate, can't. And that would then obviously lead to problems with the lungs, would it?
Absolutely, isn't that correct, Joanne?
Yeah. Joanne, the complications arose during your pregnancy, so you knew all was not well.
Yes.
At a certain point in your pregnancy.
I was offered at 12 weeks a nucleophile blood test. Okay. And I took it and it came back that I was a high risk, 1 in 17 for Edwards, 1 in 17
Edwards syndrome.
Edwards syndrome and chromosome 13 Paediatric syndrome. And I was 1 in 37 for Down syndrome.
Okay.
So
but then you had further tests and they were clear.
For Edwards, I had an amniocentesis done at 36 weeks, and I was told it was clear for Edwards and it was clear for Paediatric, but it was inconclusive on Down syndrome.
Okay, but I presume you kind of sighed a little bit of relief at that stage.
Yes, I did.
So when Cian was born then?
He was fine. We were told he was fine. He was a little bit floppy, and then 2 hours later he took a major aspiration and was rushed to ICU. And then we were told he had a lot of symptoms. He had a wide nasal bridge, he had skin tags. There was just a list then after that.
And when you saw him the first time, did you have a mother's instinct that there's something wrong here or not?
He
quite
looked
right,
to me, when I saw Cian the first time, in one of the pictures you could see that he looked like he had some Down syndrome in him.
But he's partially Downs, is it?
Yes.
I'd never heard of somebody being partially Downs before. I mean, I know there's degrees of it.
It's translocation of Down syndrome, so some of the cells have linked onto his chromosome 5.
Okay. But I mean, okay, and obviously that's a difficult thing for any parent to deal with. But when they told you about Cri du Chat?
He was 3 weeks old. We got genetics involved and they did a microarray which sent off to England. And that came back in 3 weeks to say that he had Cri du Chat.
And when they told you that, they also told you that it was life-limiting?
Yes. They told me he'd have had developmental delays. That was in July. It was when Cian ended up in ICU in October. And they were told he was aspirating his own secretions, that they didn't think he would last. There was nothing more they could do and he probably wouldn't last till the end of the week. Now,
they will never understandably give anybody a time frame in this, but when they tell you that when they bring the palliative care team in, then that's as blunt as it gets, really, isn't it? So, I mean, I'm not going to ask what was that like, but how do you deal with that? Or
you just pray and hope.
Really?
I think the inner strength just comes in out, and you look at him fighting hard, you get the strength to carry on and keep going for him.
So he's 10 months old now.
He is.
He's in hospital, but he's just come out of ICU.
He has yesterday, came out of ICU. He fought another chest infection on his lungs. Again, he was partly ventilated on Friday evening. Till Sunday he was on BiPAP machine and came off that, and now he was moved to a ward yesterday.
Okay.
So has fought another infection.
He's a little fighter, isn't he?
He is.
Again, so let's go back to the science bit, Caroline. In terms of caring for somebody like Cian, what's involved?
Well, I suppose Cri du Chat is one of 100 syndromes that we would have children on our books. You know, we've 300 families.
You work in this
with Jack and Jill.
With Jack and Jill, of course.
So there's 300 families with over 100 different diagnoses, all different conditions, and some families have no diagnosis. But the important part is to deal with the symptoms and the quality of life for the child and the family. So really a lot of the care can be similar. It's just dealing with all the different issues.
Do you have to be specially trained to deal with someone who has Cri du Chat? Is it a very specialised skill
Well, again,
set?
the type of nursing that Cian requires is paediatric nursing. Most of the children most of the nurses have experience in looking after children similar to Cian who would require regular suctioning, administration of oxygen, administration of nebulizers, peg feeding, which is he's fed into his tummy. So that is specialised in itself.
Of course.
Yes.
So I should correct me if I'm wrong. Cian's routine would be, for example, he would need feeding, suctioning, and this has to take place at definite times. For example, 10 p.m, 12 a.m, 1 a.m, 3 a.m, 6 a.m.
Absolutely.
So how do you get a break from that? I mean, you can't do that in one shift of people can't deal with that. Yeah. That's got to be multiple.
Well, I suppose Joanne, when I met Joanne last September in hospital, she was waiting for a home care package, and again, there's no paediatric budget for children in Ireland, so she had to wait until a package was sanctioned so she could go home. So she was lucky she got her night cover from the HSC, and Jack and Jill, we provide 40 hours in the month she can use that for days if she wants. That's really how she gets out and gets a break. I suppose night time, it's bed for sleep. So again, it's just about, you have to have a break. You can't do it 24 hours. Yeah. And I suppose Joanne is very lucky. She has a son, Shane, who also cares for Cian. And we also fund Shane as a carer. We, pay him to do some hours as a carer as well. So they're a fantastic family. They're a credit to Cian. And I think a lot of Cian and how he's doing is based on the care he receives at home. Home is where the family want to be with their child. They tend to do better socially, emotionally.
Well, his fighting spirit, he didn't lick off the stones.
Definitely not.
Joanne, this is a brutal question to ask, but I'm going to ask it because it's the state of the nation that we live in at the moment. If you had to rely on the state services, where would you and Cian be?
I'd probably be sick myself. Basically,
you couldn't
do it.
You
couldn't do it without the whole help I'm getting. The HSC, Jack and Jill, Shane himself, my husband. My family are there as support, but they can't care for Cian. I have an older son, Craig, who cooks me dinners. Yeah. He can.
Every little helps, isn't it?
Every little help, but you just couldn't do it.
So this is a full-time job for everybody in the family to all intents and purposes, isn't it?
Yes. Cian can't be left on his own for a minute, even to go to the toilet. Do you know what I mean? Because if he coughs or aspirates or anything, you have to be there to suction.
Well, look, we've put the Facebook page and details up, and there has been fundraising going on. There was a wonderful day in Charleston recently, which I know the local police in community police in Finglas got involved and raised a lot of money for you. It's called Care for Cian, and just look, it goes without saying. Continued good offices and best wishes to everybody in Jack and Jill, because the work you do is phenomenal.
Amazing work, wonderful
and
work.
Thanks to all the public, because obviously without their support we couldn't continue doing what we do.
Well, listen, thank you very much indeed.
Joanne, thank you for being so brave.
Now, after the break, photographer Jenny McCarthy will be exploring